No, I am now, yes.
Thank you, Viv. Okay, welcome everybody to the Bromford and Hodge Hill Joint Ward Forum with Ward End Ward. My name is Councillor Diane Donaldson. I'm one of the councillors for Bromford and Hodge Hill Ward, along with my colleague Councillor Majid Mahmood. And we also have Councillor Mohammed Iqlaq, who represents the Ward End Board with us this evening. So it's going to be a joint meeting, and it's about the main agenda item is COVID-19 update. I must advise everyone participating that this meeting is live recorded and will be available for future record. So the usual rules apply. We'll be having a presentation from Darag Fahi. I think I pronounced that correctly, I'm not sure. And on COVID, so on the test and trace, and an update on the latest information. And then afterwards, if we leave the questions to after the presentation, I'll take questions. If you put your hands up, I'll take them in order as they arrive, three at a time. Right, so I'll hand over to Darag. Welcome to the Bromford and Hodge Hill and Ward End Ward Forum.
Great, thank you, Councillor. I have to say, I'm just only realising right now that this is a combined meeting with Ward End. So what I was going to do is I have some updates in terms of what's going on in Birmingham as a whole, and then because I thought the focus was just Bromford and Hodge Hill, we asked our analysts to give us some data relating to that. So we actually are missing some data pertaining to Ward End, but I can certainly get that data and provide it for whomever is appropriate tomorrow. So apologies for that in advance.
No problem, that's fine.
Okay, so I mean, there are a number of different presentations that I could potentially use, but everything is happening very quickly and things are going out of date. So I think probably best is just to do a verbal update, and then I can take any questions and we can go into more detail as needed. I think probably is the way to go here. Just the latest figures in terms of COVID incidents for Birmingham. So I'll start with Birmingham as a whole, is 87 per 100,000. And that represents a very significant increase as we're aware of. I think the rates were something along the lines of they'd gone down as far as maybe 16 per 100,000 if about 3-4 weeks ago. So we are seeing a very substantial rise, and it compares to 71 per 100,000 for England. So, and that's over the past that's a 7-day rolling average, which represents a 41% increase compared to the previous week for Birmingham, and a 49% increase for the previous week for England, which the fact that it's increasing obviously is concerning, but it is somewhat reassuring, although only mildly reassuring, that we are tracking just under the rate of increase for England, because at one stage our rate of increase was higher than England. Then if you look at the 14-day rate for Birmingham compared to England, it's 149 per 100,000 versus 119 per 100,000 for England. So still overall the case rate is significantly higher for Birmingham than England. We're seeing that it's highest in the 17 to 21 age group, and particularly we're seeing an increase in rates in the 60-year-old age group, which is somewhat concerning. In terms of breakdown by ethnicity, it's 44% in the British community and 19% in the Pakistani community. So looking at the PCR tests, in terms of positivity, we are seeing very high positivity rates, which compared to what we saw maybe 3-4 weeks of 5.2% for Birmingham. It had been about 0.8% about a month or so ago. The English rates are about 3.6% positivity. That was kind of tracking at around 1.2% about a month ago. In terms of lateral flow testing, our positivity rates are about 0.4%, which is probably doubling of what it was compared to about a month ago. And in the UK, in England, it's 0.3%. in terms of where we're seeing it, in terms of situations over the past week, we saw 96 situations. So these are clusters or outbreaks. 50 of those we see in an educational setting and 35 in workplace settings. Currently, we're seeing an increase in admissions within different NHS settings and local hospitals, of course. But at the moment, it's manageable, but clearly it's something we need to monitor very carefully. So probably what you have seen, or some of you may have been made aware of, is that Birmingham is now, just as we've seen for places like Bolton and Manchester, has been targeted as a place for enhanced support. And so there's been a national announcement around that. It's just been filtered through. So effectively, what that will mean is that there will be advice, both local and national advice in relation to Birmingham. So for Birmingham residents, they've been advised not to travel out of Birmingham, and people coming into Birmingham have been advised to minimise their travel into it. And then there's a huge reinforcing of the core messages around infection prevention control, taking up your testing twice a week, being isolated or being adhering to your isolation if you need to isolate, and obviously taking up the vaccination. So a lot of this, of course, is really stems from the introduction of the Indian or the Delta variant, which now is the predominant strain that we're seeing in Birmingham. And it probably represents about 95% of all cases that were isolated. So again, about a month ago, if we looked at the stats, we would have seen the Alpha or the UK Kent variant as being the dominant variant in Birmingham. This has been greatly surpassed now by this Delta variant, which is a trend that we're seeing both in West Midlands and in England. And the danger with it is that it is 60% more transmissible than the Alpha variant. So clearly there's more scope for spread. In terms of susceptibility to vaccination, the data underpinning the stats that I'm about to give you is relatively small, so take it with a pinch of salt. But the indications are, if you look at both the Pfizer and AstraZeneca vaccine, that you'll get about 33% efficacy with the first dose, and with the second dose with Pfizer, you'll have about 80% efficacy against this Delta variant, whereas compared to 65% with the AstraZeneca vaccine. So, in short, what you're seeing is that with 2 doses of AstraZeneca or Pfizer, you are getting a decent level of protection from what we can tell. But there is quite a gap between the protection you get from the first and second dose, which is why one of the biggest initiatives we've seen recently nationally is that push to ensure that anybody who was scheduled an appointment to come back in 12 weeks for their second dose are now being told to come back in 8 weeks. And so in terms of this whole enhanced support campaign, the big focus, of course, is on increased testing, more contact tracing, improving the vaccine uptake, particularly second dose, and ensuring people isolate. And one of the things we've done locally is to identify wards which we think have particularly high incidence rates with low testing and low vaccination uptake. And we're going to be targeting those areas in a number of ways. One will be, we'll be doing door-to-door lateral flow testing. So that's going around to each household and talking about the advantages of testing, and then providing people with lateral flow kits that they can self-administer. We'll also be doing a lot of targeted vaccination in those wards. There'll be different pop-up vaccination clinics, and we'll have mass vaccination sites that people will be invited to attend. And there will be just a greater availability of the vaccine, both in terms of GP availability and pharmacies as well, because more and more pharmacies are being given the license to provide the vaccine. So that is a focus of our efforts at the moment. The Pfizer vaccine, you may be aware, is in short supply, so we are looking for support nationally to try and make sure that doesn't become a hurdle as we try and roll this out over the next 4 weeks or so. So With the isolation as well, we're also trying to, again, get the message across about the importance of isolation, and we'll be looking to extend the isolation support package for people who are on lower incomes and are not getting paid when they're isolated, because we know there's a potential barrier for people. If they're being told to isolate but they are receiving no income, then there is financial support from the government. So we're looking to try and get that extended to encourage isolation, as well as further enforcement from our local environmental health officers and COVID marshals, local police. So we should see a greater presence in relation to that going forward. And also, I think in schools as well, we're looking to try and have face coverings mandated. I don't think that will happen right now, but at least we'll be working with the principals to try and encourage face or mask wearing in the schools, particularly in the secondary schools and also in universities with increased testing. Ideally, we'd like to also just do a once-off PCR test of all secondary school children in Birmingham, as well as all students attending universities, because we feel they're a significant source of this transmission. Okay, so that's Birmingham as a whole. I'll just go on to some more specifics, and this just pertains, unfortunately, to Bromford and Hodge Hill. And apologies, we don't have the data for the other ward, but we can get that to you. So generally, we're seeing the spread seems to be primarily occurring through household, social, and workplace interactions. And in terms of the overall data for Bromford and Hodge Hill ward, we're seeing that your rate is about 65 per 100,000, and that compares to a rate of around, as I said, about 88 or 87 cases per 100,000 for Birmingham. So which means you're ranking about 44th out of 69 wards, where the first is the highest and the 69th is the lowest. So your rates are better than the average for Birmingham, and you've 10 COVID champions, which is obviously good news. The area that probably is of concern when I look at your stats is more to do with your vaccination rates, which across all the priority groups is lower than the Birmingham average, and probably around about maybe 10-15% lower than the Birmingham average. So if you take, for example, all of those aged 80 years or older in Birmingham, you're looking at rates of about 90.4%, whereas for Bromford and Hodge Hill, it's 76%. And for those, if you go down again to those aged 40 and over, your rates are 49.5%, and for Birmingham, they're 61.3%. So I think a more concerted effort to improve your vaccination rates would be critically important, I think, for this ward. Just to give you a bit more specifics, then, if we look at the number of COVID cases during the 30-day period between the 15th of May to the 13th of June in your ward, we found that 27% were in the 0 to 19 age group, 43% were in the 20 to 39 age group, 25% in the 40 to 59 age group, and 5% in the 60 to 79 age group, but no cases in the 60 and above age group. And then if we look at the breakdown for that same time period in terms of ethnicity, 63% were of the Asian ethnic group, 80% in the Black ethnic group, 2% were mixed other, and 10% in the white ethnic group. Okay, so that's a sort of a whistle-stop tour of the latest stats, I suppose, for Birmingham and situation, and obviously some stats pertaining to Bromford and Hodge Hill, and I will try and get those stats in relation to Ward End tomorrow, if that's okay.
Yeah, thank you, Darag. Yeah, that was very informative. What I wanted to ask about Bromford and Hodge Hill, Ward End has had a successful programme that they operated from the library over, I think it was a 4 or 5 day period, and it was actually featured in the Birmingham Live, showing the queues outside. Can we have something like this in Bromford and Hodge Hill to address this
Yeah,
low vaccination take-up?
I mean, ultimately, it's the NHS who will decide, but we tend to work very closely with them and make recommendations, certainly for locations and locales So I certainly can get that message to my colleagues there in the NHS to try and put something like that in place.
And also the program of door-to-door lateral flow tests.
Yeah.
Would be interested in participating in that myself, and go around and knocking on doors and encouraging residents to take that up. It's something that I do myself twice a week, and it's very reassuring.
Yeah. Okay. All right. Well, I'll talk to the people who are organising that and pass that on, Councillor.
Thank you. I'll open it up to the floor now. I've got Councillor Cllr who's got his hand up. Councillor Cllr, would you like to come in?
Thanks, Diane, and thanks for the briefing. I represent Ward End. One of the concerns I have, what you've just told us, is the shortage of Pfizer vaccine. Now, a lot of people are reluctant to have the AstraZeneca due to obviously some of the issues, maybe minor, but it does put people off with blood clots and whatever. So we had the pop-up clinic. We had to have an extra day thanks to NHSS. It was a very, very high uptake, but the first few days, because it was over 18, we had a lot of people from across the country, Gloucester, Nottingham, Derby, they're mainly students, but we specifically put some messages out in local mosques on Friday at the Friday prayer. So Monday it was mainly local people. I think we've done close to, in total, 1,700 people just at Ward End Library. And I think one of the successes across Birmingham amongst Asian and ethnic communities, and especially Muslim communities, was in Green Lane Mosque. So I think, if you work with the NHS on where the locations are going to be, firstly, Bromford and Hodge, and obviously all the localities, Alum Rock, we need to find somewhere where we can reach the ethnic minority communities. And I think it would be really, really good if we can utilize the mosques. The uptake, I'm still surprised, is quite low. But have we got the data? Once you do the door-to-door flow tests, do we have the data to say in this household, there's 5 people and 3 of them have not been vaccinated? Until we get that data together to find out, we just relying on people to come forward at the moment, because there must be data, because it's all on record once you give your NHS number, so exactly who's been vaccinated and who's not, and it'll be easier to actually target once we've got that data on where the people have not had the vaccinations. And just on the I call it the Indian variant. I know, they've got different names for it now, but it is. But across the UK, they reckon 90% of the cases are the Indian variant. Is that so for our locality as well? Other than the Delta variant, is it just that Delta variant? And it'd be interesting to see. I know you give us figures on the people, on the ethnicity who haven't had the uptake on the vaccinations, but I think we need to be a bit more specific and get that data on who these people are and where they're actually located, so we can. On the pop-up clinic, myself, Majid, I was there for 6 days, and we was getting people out of their houses, and fair play to NHS. Ward End Park is across the road, and there was getting people from Ward End Park, who were exercising or doing walks, who haven't had their vaccination to come over. And I was actually door knocking and phoning people. So on Monday, majority of them were local residents from either Bromford, Hodge Hill, Alum Rock, or Ward End. So it'll be good to actually target and if we can have more of these pop-up clinics. And I think the location is the key where we actually locate it. And would love to know about this, the shortage of the Pfizer, how it's going to affect the rest of the people taking up the vaccination. Thank you.
Sure. I don't know whether you want me to try and respond to some of that, or do you want to take another question, Councillor?
I think that's if you'd like to respond to that one, Darag, it's quite a lengthy.
Yeah, there's quite a lot in there. I mean, absolutely, and I think you make some very valid points, Councillor. I mean, I think one of the things we're trying to do, given the fact that we are, being highlighted, Birmingham's been highlighted as an area now that is seeing significant increases, and actually in some wards we're seeing rates that are, higher than some of the rates that we saw in Bolton in the northwest. Given that we're getting this attention, and we'll be getting quite a bit of attention over the next day or two, specifically from the media, I would think. We want to try and use that and leverage that to try and make the case that we should be prioritized in terms of supplies, whether it's supplies of the Pfizer vaccine, supplies of the lateral flow tests, or the PCR tests with responsive laboratory turnaround. So, it's absolutely, pointed to kind of say, well, it's one thing kind of shining the headlights on us, but if you don't give us the raw materials to be able to tackle the problem, then that's not much good to us. There is a very much a concerted effort around the wards with the lowest vaccine uptake in terms of pop-up clinics or low testing when it comes to testing. But as I said, we do need the tools, so we're trying to leverage political power to try and make that happen. I mean, there's been, I think, communications with the Secretary of State around some of these issues as well, including issues around, for example, is now the time for Birmingham to open up 5 hotels to take in people who need to have their quarantine managed, even if they're not Birmingham residents. So there's a lot of things happening behind the scenes to try and leverage this spotlight that we're getting. But equally, I think it's timely as well, and I'll do this. I'll go out and link with the NHS and just reflect some of the feedback that you've been providing, so that they can understand that understand what they're doing that seems to be working and what they need to be doing more of.
Okay, thank you. On the AstraZeneca and the Pfizer vaccines, AstraZeneca, I had AstraZeneca, and I had a couple of months ago, I had my second vaccine, and I do my lateral flow tests twice a week, and I've been fine. I don't think they got the negative publicity. I don't think that was fair around the blood clots, because it's a very small proportion, and the proportion of blood clots in the population normally is not much different.
No, it's not really significant at all if you actually look at the statistics. I mean, your rates of blood clots are so much higher if, for example, you're on the pill, or if you're a smoker. But more significantly, I mean, your risk of getting a clot if you have COVID is exponentially higher than the risk with the vaccine. So there isn't really any logic, but unfortunately the media got hold of it and ran with it, and then there's this level of fear around the AstraZeneca vaccine. But
it doesn't make sense.
And it seems to be very hard to get the public perception changed on this, but certainly I would have no query or no qualms in getting it myself, or advising family members to get it.
Okay, and the other variant, we don't hear much about that now, is the Brazilian variant, the Kent variant.
Yeah, we've only had, to my knowledge, only one case in. So we've got 4 priority, I suppose, viruses affecting, well, nationally. Birmingham's picture is similar to what the national picture is now. We initially started off with the Kent UK variant, which is now they call the Alpha variant. that used to be the dominant variant, but now we're only seeing, 5% or maybe 4% of cases coming back. And then there was the South African variant, and that triggered a number of, what we did was Operation Eagle type responses, which we did focused door-to-door PCR testing and encouraged workplaces in the area where there were, in the area or the ward in which there were 1 or 2 South African variant cases. We did very much targeted testing to try and pick up and ascertain the level of it. Seeing like no more than 1% of cases being the South African variant right now. And then the Brazilian variant, to my knowledge, we've only had 1 case in Birmingham. So it really is, very, very uncommon. There are a couple of other variants floating around, Europe, South America, Asia. To my knowledge, I think some of them might have come into the UK, but to my knowledge, there's none in Birmingham.
Okay, thank you. I've got Mohammed Amin, who's got his hand up to ask a question. Would you like to come in, Mohammed? Mohammed? Yeah, you're on mute.
Thank you very much, Chair. My name's Mohammed Amin, and I am a volunteer presenter on a community program on an internet radio station, Radio Aapki Awaaz, and we've consistently been giving the message out about social distancing, wearing masks when you're out in the community, but more importantly, giving the message out that vaccination is important. So there's this myth in the Asian community, well, other BME communities as well, about this medical chip that's going to be implanted, and we constantly tell people that if you're carrying a GPS phone, you've got a GPS tracker, so it doesn't make any difference. But I've had conversations with Councillor Mohammed Idris, Councillor Mariam Khan, and including Liam Byrne last Friday, and I was shocked to learn from all 3 of them that I must admit, at that time, we never had this issue that you've just mentioned. The fact that there wasn't a strategy, and I was looking at the Hodge ward, so I wasn't specifically looking at Cllr, Alum Rock, or Bromford, Washington Heath, or Ward End. I was looking at the Hodge Hill constituency, and I was looking at the national statistics, and I said, well, right, what we need to do is our message is going out, but the numbers of vaccination aren't going up. Now, I know we've had a successful campaign at Ward End Library. I've suggested a place in Cllr, which is a council-owned car park, and I said, right, let's get up this pop-up van. Let's get this pop-up van parked in there for a week. And whether it's the mosques, the churches, the schools, let's get out there. Let's get the information out there. And I've got commitment from the management of Radio Aapki Awaaz to say, if it needs being, we'll blast the message out every 20 minutes to the community to say, guys, get out there, get yourself vaccinated. However, the City Council communication team, the public health team, my emails have got into the system, and it's radio silence from them. And then I talked to the councillors and my MP, and Liam says, yeah, well, hang on a minute, we haven't got a strategy. So, and my exact point to them last Friday was, okay, God forbid, I shouldn't say this, and I apologise if people have lost their loved ones. So do we want bodies ended up in Hartman's Hospital before we're going to do something about it? And long and behold, this is this message that's coming out in the press, and even Birmingham Live, you look at anything, oh, Alum Rock's on there, Ward End's on there, Bromford's on there, and I'm thinking, come on, guys, we need to move quickly. And I appreciate NHS England are running the show here, but do we have any control to convince NHS England to say, can we have a pop-up van on our patch, and we can convince, say, 2,000 people, that's 2,000 people more, to have the vaccine? Sorry, I'm answering questions and I'm giving you a lot of factual information, but as you can see from my frustration, I can see we can help deliver this, but we're hindered by the process, and a lot of it is the bureaucratic process.
Okay, well, certainly sorry that you've been frustrated by all of that, Mohammed. So, I mean, one of the things that I can do is either if you give me your email or I can give you mine, and I can sort of get those conversations going internally with the right people in the council and indeed within the NHS I mean, we do, the NHS do lead on vaccinations, but we do work kind of very closely with them, and a lot of their decision making is informed by the data that we provide them, both hard and soft intelligence. So I think, you know, linking you with the right person, I think hopefully will bear fruit for you.
Thank you, Dara. Very reassured by your comments. What I'll do is at the end of this session, I'll drop you a personal email and I'll forward you some of the emails that I've sent into the system, and then you'll see where I'm coming from. But as I said, we've got commitment. I know a lot of the media outlets. If it's bad news, great, but this is a community radio station, and it's all members of it's not just the Asian community. We've got the BME community, we've got the Eastern European community, and the programs go out in 12 different languages. So I'm certain somewhere out there, even if it's 12 more people who pick up the message, there's 12 more people vaccinated. And if it means that we can just cancel the programs and put this message out every 10 minutes, we will do it. And that is a big commitment from a radio station which wants to deliver the message. And the councillors, Councillor Majid Mahmood, Councillor Cllr, both of them have been on that radio station. So it is very effective that we can get the message out in the community. We just want to be part of the council delivery team. I don't want to constantly talk about the bureaucratic system we're fighting with. I want to be working with you, be part of you, and we want to try to eradicate this Delta variant. But yeah, thank you very much. Really appreciate your comment.
Sure, no problem. Yeah, happy to help.
Thank you, Mohammed. I mean, thank you.
Thank you.
Very useful questions there. Beverly's put in the chat. Direct email address is in the chat for anybody who wants to pick it up. I've got Councillor Mahmood, who's got his hand up. Would you like to come in, Councillor?
Yeah, thank you, Chair, and thank you to the presenter for coming to our ward forum. And I think, whilst I appreciate all the support Radio Archivars has provided to the various communities in and around Hodge constituency, there is a lot of information that was brought through by the City Council with the resources that we have got. But this is an NHS strategy that's been delivering the communications across it, but we have been helping on Facebook, on Twitter, and other platforms. And I know that the council has relationship with Unity FM, one of the largest radio stations in the city that has a reach of millions, not hundreds, millions. And I was privileged to be on Unity FM to promote the vaccination hub that we had outside Ward End Library. Bear in mind, that was the first vaccination hub we had, and we managed to get that on the base of the high case rates and low vaccination rates. But the low vaccination rates, it's not just something that is specific to the BAME population in the city. There's, across the country, there are other BAME populations which have got lower vaccination rates than Birmingham itself. The good news is today the NHS has recognised that based on the lobbying of both the officers at the City Council, elected members, and the NHS CCG team after the success of the vaccination hub that we had in Ward End and in Neachels. I think it's today, it's in Lozals today and for the next few days. And I believe it's in Haymills, Tyseley as well, is that there's going to be a rollout to 15 wards of more resources. And that kicks off from today. I've not had all the information because it was just given to us quite late in the day today. But Bromford and Hodge and Ward End, good news is it is within the 15 wards. So there should be at some point more vaccination hubs available for the people. And, I was one of the ones that worked with Green Lane Mosque at the outset, encouraging them to apply to have a vaccination centre created. And it's been really, really successful. And the same should happen in terms of pop-up clubs, pop-up clinics across both Ward End and Bromford and Hodge. And, Alum Rock is just on our border. We're all within the same constituency. If we could have vaccination hubs based in all of those different localities. And more importantly, and I've said this before when I've been interviewed on Unity FM, is that we need people to speak to those people who have been offered the vaccination but have not come for the vaccination. There is quite a number of people that have done that. And I think that's more of a challenge for us than getting other people vaccinated, because when it was opened up to the over 24-year-olds last week, there was more than 1 million people booked a vaccination, which means there are lots of people ready for the vaccination, but it's the communities, the people that haven't come forward. And another part of that, which I think the officer could probably help us with by liaising with NHS, is to identify the number of people who have been offered a vaccination, especially within the South Asian communities who aren't actually in the country, because we've got lots of family and friends who are still in Pakistan, Bangladesh, or India. And although they've been offered, they haven't come forward, not because they don't want to come forward, but because they're not in the country and because of the restrictions placed on people returning. And in Kashmir, where the majority of the people are from, in the city, they've got their own local elections, well, parliamentary elections for the legislative assembly. So there's lots of people over there that have been offered, and it would be good to find that percentage of people who have not been, who aren't in the country, so aren't able to have the vaccine. And secondly, we need to find some local people, local doctors. We've got lots of GPs to go on a roadshow, to speak to people, go to their houses, get the GP to speak to patients who have been offered the vaccination but haven't come forward for whatever reason. We had a lady, Councillor Clark, remember this, who came to the Ward End vaccination hub. She was in her 90s in a wheelchair. And, Councillor Clark asked her the question, how come you've not gone for a vaccine? She goes, look, I wanted to get a vaccine, but my son was in Pakistan at the time when I was offered it. And second time I was offered it, I wasn't able to get it. Then my son saw this, her grandson saw it on Facebook that we were promoting the vaccination, and she came to the vaccination. And those are the type of people that we need to get. And within, most of the people that live in Bromford and Hodge, the majority are Muslim. And we've got within the Quran, it says, whoever saves one life, it's like saving the whole of humanity. And that message needs to go out in every single mosque on a Friday when they have their prayer, so they can maximize the number of people that are getting that message. And that's what I think is really, really important, that whether it's city council officers, whether it's elected members, whether it's members of the community who speak to these people that haven't been vaccinated. I spoke to my mom even and asked her, have you been vaccinated? She goes, no, I haven't yet. I haven't had the message. Then I checked. She did have the message, said in a letter, but she just basically was watching Asian TV and she was put off by having the vaccination because there's misinformation that comes out on the Asian channels. So it's our job working with Radio Abka. And Radio Abka, it does a real good job. It's only an online platform, unfortunately. It's not an actual radio station where we can deliver to literally, millions of people like Unity FM or the other radio channels that we have in BBCWM. But I'm more than happy. I have been invited to attend the show, and I think it would be good to have a communication with them. And the other thing that we did in Ward End vaccination hub, which we failed to do previously as a council and a NHS, is we got one of my friends on the Washbeath Road. He's quite friendly with a lot of the East European community on the Washbeath Road, and we found out that they weren't coming forward for vaccination. So we actually translated the message that we were given in English into Romanian and other East European languages, and we physically distributed them to the individuals there on the Washbeath Road. And this was quite shocking. They didn't even know the vaccine was free. They thought they had to pay for the vaccine. So they weren't going for the vaccine because they thought they had to pay. When they found it was free, and it was a Monday, because luckily NHS agreed to bring the mobile van on the Monday, loads of them went over to get vaccinated. And it's not the fact that they got vaccinated, it's the fact that they then went home and spread the message to their families and friends that, look, you can get the vaccine, it's free, these are low. That's why it's really important. The strategy has to be, we get more vaccine hubs, we use all platforms, online platforms, social media, any platform we can get to reach the people, to get them vaccinated. And thirdly, and I think most importantly, we do need those community figures from the medical profession to speak individually to those people that have been offered the vaccine and haven't come forward. Thank you.
Thank you.
You're on mute, Di.
Sorry, thank you, Majid. I'll pass over to Darren now. He can respond to the points raised.
I wouldn't disagree with anything that you've said there, Councillor. I mean, I think, one of the challenges with the GPs and the kind of local healthcare leaders is that they're spending so much time actually having those conversations one-on-one with people, or actually getting involved in providing the vaccine, or indeed trying to deal with the backlog of non-COVID related health demands that it is more difficult to get them to kind of come out and speak at different fora and listen to different Q&As, because really, I suppose, I know people are more likely to listen to a local healthcare professional, but a lot of the GPs, what they're doing is they're looking at their own list and they're looking at individuals who've not come forward, and when they get a few minutes, they'll ring that person just to say, I see you haven't had the vaccine, and have the conversation with them then about what their concerns are. And then it doesn't always, you can't convince everybody, but as you say, if you can get people who are kind of on the fence, or maybe who misunderstood what the vaccine was about, or whether you have to pay for it, for example, then you can get a cascade effect where they then spread that message amongst their community, and you can get quite a spike in demand. So I think all of those elements are extremely important, and again, it's something I'll feed back to my NHS colleagues.
Thank you, Dara. I thought I saw Pat's hand up. I don't know if you wanted to ask a question.
Well, I think we are getting to that stage. I think we're not quite there yet.
Which Pat?
Yes.
Diane, me.
Pat. I've got two Pats.
Yeah, well, no, it wasn't me. Okay.
No, it was me. I raised my hand because I wanted to know if there was anybody that reached the Romanian community, but Majid answered the question, so I'm glad to hear that.
Right, thank you. Any more questions? Anyone else like to ask a question? No. Dara, just referring to the Prime Minister's announcement, I just briefly caught his announcements this evening. Do you think we'll be on track to open up for the 4 weeks? So it's the 19th of July now? Or is...
Well, I certainly hope so. I mean, of course, a lot of it is going to, it's probably going to be, there's two aspects to it, whether nationally in the UK, England, will England open up, and then, will exceptions be made for certain local authorities that are struggling, would probably be the way I would look at it. I'd like to think, I think one of the things that was seen in Bolton and in the Northwest was that the rates kind of crept up, just as they've been creeping up in Birmingham over about a 3-4 week period, and then they went on an exponential rise. And I think if we can stop the exponential rise and level things out and start reversing the trend, or at least holding the rates as they are, then I think there's every reason why we can sort of feeling confident about the future and lift the restrictions. But if we start to see any of that exponential rise, then there will be certainly a lot of scientific pressure put on the from the scientific community, will be pressurizing the politicians not to lift those restrictions. But obviously there'll be a lot of political pressure or economic pressure to lift them. So my feeling is, I think I'd be in a better position to advise or give a proper prediction in 2 weeks' time when we see what the rates are doing. I mean, it is a little bit reassuring that the rates aren't increasing at the level they were, but at the same time, 40% increase from 1 week to the next is not great, and you definitely want to try and stabilize that and ideally reverse it.
And what sort of is the death rate in comparison to the infection?
We're not really seeing, it's not really been converted into significantly, we're not seeing an increase in the death rates at the moment. We unfortunately did have a very sad situation where a child died, a 13-year-old died of COVID recently. But in terms of the overall rates, we're not seeing an increase in the death rates. We are seeing an increase in hospital admissions and the use of ICU beds, but not to the scale or the level that we would have seen back in January or so. And I think some of that relates to the actual core rates. They're still significantly lower than they were in January, February, but it also relates to the fact that people are vaccinated, and although they're not getting perhaps quite the same level of protection as they would do against the Alpha or UK variant, they are still getting a level of protection that reduces the risk of hospitalization.
Thank you. And can you just run me through the different variants? And it says that we've got alpha.
So the alpha variant is the UK or the Kent variant.
Yeah.
And then the beta variant is effectively the South African variant, and then the Delta variant is the Indian variant, effectively. Yeah.
Okay. So we don't have a C variant.
One has been given the confusing thing was they were trying to move away from associating it with a particular country in case, you know, people were getting inappropriately abused. And then they started including April 01, April 02, April 03. So now they've changed the nomenclature again. But I think for the moment, if we just think about the Delta variant being the Indian variant and the Alpha variant being the UK Kent variant, I think that will account for most of the discussion at the moment. You're on
mute, Di. You're on mute.
Sorry, Councillor Clark, you're next, and then I'll take Patricia.
Yeah, just a quick point. When the traffic signal came in, Darag, India was one of the last countries to be put on the red list, and now we have 90% of the variant, Delta variant, you know, which is the Indian variant. When the government eases lockdowns in UK, would it have any impact on the countries, on the traffic light system? Because I think the government got it totally wrong when they actually put the countries into the red list. The ones that should have gone into the red list didn't go into the red list. The infection rate in India was 5-6 folds more than what it was in other countries that were put on the red list. India was put on the red list very, very late. Now we've got 90% of the infection rate of that variant. So I think they'll need to play clever. And even after a month, if they ease the lockdowns, they've got to really, really look at these traffic signals from other countries, people actually coming in and bringing that infection over. I know the when they actually come over and they're in quarantine, it's different being quarantined in a hotel and at home, because you'll still get, because they are very, very strict in hotels. I've known people who actually come over and, you know, they get 3 or 4 times a day, could go out and stretch their legs for 5 minutes. So they are proper quarantines, but you can't say that for people who are quarantining. So I think the government will need to have a real good look at that, even if they start easing the restrictions. Thanks, Jay.
I mean, I think it's a valid point. I think a lot of people feel that the UK should have reacted earlier in terms of what was going on and put India on the red list earlier and introduced the stringent managed quarantine services earlier. Boris Johnson feels differently, but there's no surprise there. But yeah, I think, you know, it's about not only getting access to really good international intelligence, but responding to it very quickly and very thoroughly as well. And it wasn't just India as well. It was a lot of the surrounding countries as well were experiencing these high rates with this variant that we hadn't seen before. So yeah, hopefully we'll learn a lesson from that.
Thank you, Dara. I've got Patricia who wants to ask a question. Patricia.
Thank you. On the statistic that you gave us about Birmingham, can you tell me how many of those that have got COVID had been vaccinated and how many didn't have the vaccine?
Yeah, it's a good question. I don't think I have access to that data. I wonder whether my NHS colleagues will have it. I can tell you anecdotally that I've been told that staff in the hospitals who have had both doses of the vaccine, some of them are getting COVID again with the Indian variant. But Yeah, you know, what I'll do is I'll go back and I don't know whether that statistic is readily available, but I'll certainly explore it. And if it is, I'll pass it on to you.
That's great. Thank you very much.
Sure.
Thank you, Patricia. Thank you. Dara, do you think we'll have a third round of vaccinations in the winter?
I think it's, yeah, I would imagine that we probably would. It'll probably be combined with the flu vaccine, is what I would think, is you'll have your flu vaccine and a booster. A lot will depend. Certainly, if we have another variant which is even less responsive to the immunity that's been derived from the current vaccination program, then absolutely we will. But I think the chances are that we will, provided that we can work out the logistics of it as well. And some of it is about balancing the risk and the impact on the NHS, because as we're focusing so much on COVID and everything that it's and its behaviour, obviously there's a huge backlog of non-COVID related NHS work that needs to be done, and we need to make sure that we don't lose sight of that as well. But my good feeling is that there will be a third. It'll be a booster dose, and it'll go with the flu vaccine.
Okay, thank you. Any more questions for Dara? No. Beverly's typing a message, so I'll just see what Beverly wants to say. But I think we've covered. So really, what we need to see is more of localised pop-up sites in Bromford and Hodge Hill. Definitely something along the lines of what Ward End had. There's definitely a need, and I look if there's the lateral flow test going around Bromford and Hodge Hill, knocking doors. I'm sure my colleague and myself will be there to help out, and Cllr in Ward End, I'm certain.
Yeah, great. It's already been rolled out at the moment in Alum Rock and Small Heath, so it should be coming to you very soon.
Okay, thanks, Dara. Thanks for coming along this evening at such short notice, and send our best wishes to Dr. Varney.
Well, indeed. Yeah. Take care.
Okay.
Nice
Thank
meeting
you. And you. Bye-bye. Bye.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Right. Thank you, everybody. It was an interesting discussion, and a lot of information coming forward there from Dara. We'll move on to just ward updates. If there's Councillor Cllr, would you like to go first, an update on Ward End?
Yeah, thanks, Diane. We've already discussed the pop-up clinic.
Yeah.
We've had a couple of litter picks, well, 3 litter picks this week. Thanks to Feroza, we did Pound Green. Then thanks to Maxine and all the volunteers of Friends of Ward End Park, we did Ward End, and I believe Ali organised one on Thornton Road this week. I think it was Sunday. Other issues, just fly tipping. I mean, unfortunately, we're not in the other meeting discussing that today, but I'll catch up. Still, a lot of fly tipping, and it's the regular hotspots every time. And as soon as it gets picked up, it takes just a day or two. It's always the same spots that the fly tipping takes place.
I think that's for most of the city. I think that's the case.
Yeah. Hopefully, in the other meeting, I was just trying to listen in while I was at this meeting. John O'Shea's there, looking at implementing some new measures to actually catch the fly tippers. So enforcement is going to be the key on fly tipping. We had a huge cricket tournament in the artificial cricket pitch at Ward End Park, and thanks to all the players, I left them some bags, and they actually picked up all their rubbish. I went this morning to have a look, and the park keeper, he actually took it away. Speeding still an issue in Ward End. Ward End Road, which is very dangerous because it's next to a school. Main Washwood Heath Road, Drews Lane, even though it's 20-mile-an-hour zone now. I know we get some speed checks every now and then, but they can't be there, you know, all the time. So I've got a petition on traffic calming measures on Ward End Road and Ingleton Road, which I'm going to submit in full council on the 22nd. There's still fly tipping, so I'll have a meeting with the some of the volunteers from the school. Mrs. Rose, the head teacher, she actually organised the petition. So hopefully we'll get something done along them lines. Burney Lane, potholes. Story of Birmingham at the moment. Across most of the wards, because it's been changed, the depth of a pothole. When is a pothole not a pothole? So the PFI contract, they're just renegotiating with Cllr. So hopefully we'll get some work done on the road servicing as well. And we've got a new sergeant for Bromford and Hodge. Met him on Thursday, and some of the regular PCSOs. So they'll be going around Washwood Heath Road and keeping their eyes open, and illegal parkings. That's, you know, another issue which I had a chat with the sergeant. So they're going to make sure they're patrolling around Washwood Heath area by Paddy Power, and that's about it.
Thank you, Councillor Cllr. That's I think that reflects the issues in all of the wards, and certainly in Bromford and Hodge Hill. We had a HLB litter pick on last Friday, so we managed to litter pick in a lot of the wards in a lot of the roads around Bromford. And it's the same areas, Bromford, because of the way it's got little alleyways and garage areas that are secluded. So it's a big attraction to fly tippers. Also, there's a lot of fly tipping behind the shops, because I've spoken to some of the shopkeepers today, and they need to keep the gates closed, because we've gone to the expense of putting gates on and fitting padlocks, but they're not utilising them. So that's people are there and they know that the gates aren't being locked, so they will continue to fly tip. Yeah, and speeding. Yeah, we have the same issue in Bromford and Hodge Hill. Myself and Councillor Mahmood, we did a speed check with the PCOs not long ago, and that, so we're looking into some traffic calming measures to be installed along Stetchford Road and the Heathway, which are the main two roads that we have reports about. And got Councillor Majid Mahmood, he's got his hand up. Would you like to come in?
Yeah, thanks, Chair. Sorry, I'm just in another meeting. Let me just put the volume down on that. I've got my earpiece on for that meeting.
I'm trying to listen to that one as well. I'm picking up messages in the chat.
I'm using my left ear here for this meeting. So yeah, just obviously we've had the announcement today from the Prime Minister, the extension of the final hurdle before we're brought out of lockdown. So we were hoping to make an announcement tonight that we were going to resume face-to-face advice surgeries, but that's not going to be possible until we see the detailed breakdown of the new guidance. So I think for the moment we'll just continue with 1 to 2 online advice surgeries the first Saturday, and the third Saturday of the month, myself and Diane, we have a rota for that. So if any residents from Bromford and Hodge will need to contact us, they can. Obviously, we're also available on the telephone and the email. We had our meeting with the highway engineers around our highways budget. We get a budget of about, I think it's about 22,000, but then we can't take into account the number of disabled bays that we have to pay for, because that comes from within the local minor measures. And what we've decided to do, because you're all aware of the fatalities and serious road traffic accidents that we've had on Stechford Road. I think Diane mentioned it as well in terms of speeding and how we've carried out speed enforcement exercises, is that we've allocated the money, including some that we carried forward from last year into this year, for 2 or possibly 3 pedestrian refuges on Stechford Road, because that tends to slow down the traffic, but it's also legal, so it allows so we don't get any opposition from the emergency services, because it's a strategic route, so it's hard to get speed ramps on there, plus they're too costly anyway. They're similar to the ones that we put on Bromford Road 2 years ago outside the school campus. And as you were, Colborne Primary, one of the largest primary schools in the city, in fact, is on Stechford Road, so that will help alleviate the speeding on that road. We've had a campaign around abandoned cars, because we've had so many reported. Well, I refer to them as abandoned cars, but we don't know if they're abandoned. All we know is that they either haven't got road tax or they haven't got MOT. And during COVID, the early lockdowns, it was very difficult to get them removed, and because of the extra provisions that was given for people to get their MOT. But now we're hoping that there's a collective approach between the DVLA, the police, and the city council in removing some of these vehicles. Some of them, I actually got a report this morning of one from Alum Rock on Chartist Road, where a van's had its windscreen window smashed, and it's been about 6 months, and it's still there, hasn't got MOT, but it does have road tax. So those type of situations, something that the local police, and hopefully at the next ward forum, we can invite the new sergeant, Alan Davis, and see what he can basically assist us with. We even had one in Chardin reported to me around an abandoned car that had been there for 5 years without road tax or MOT, but it was on a private road which was adopted by the city council. So because of that, city council wouldn't remove it. The police are saying it's a private road, so it's quite challenging, but we'll get there in the end in terms of getting those removed. Obviously, anyone who lives in Bromford and Hodge will know about the Fatberg, which we as residents in Bromford and Hodge are not only to blame for this. The blame lies on the whole of Birmingham East and North Solihull. So remember that. I don't want anyone discriminated against in our ward. Had a meeting, on-site meeting with Severn Trent, and we basically, there's some news. There's going to be some news coming out in the next few days. There's a number of discussions that we had around trying to minimise the disruption to residents. And one of the biggest issues we've got is a traffic light system and the huge pipe that's on Chipperfield Road and comes onto the pavement. It's causing disruption both the householders and for people who use that route to get into the Bromford. And there's just waiting on the senior officers at Severn Trent to agree to what we've suggested with the people that came from Severn Trent, and hopefully that will resolve itself soon. I haven't actually got a date before someone asks me for the date when that disruption is going to end, but we're trying to minimize disruption because I know it's having an impact on people who live on Collingbourne Avenue because it's closed from the one end, especially those that go in shopping and they got big shopping bags, and the private hire drivers will drop them off at the end. It's difficult for them, so we're looking into that, and hopefully that will resolve itself. We've got the usual cases of fly tipping, and myself and the chair report considerable amount. And in terms of the statistics in the city, we're like towards the higher end of fly tipping. But if you look in the streets, they're not as bad as other parts of the city. But I think that's primarily because we've got some brilliant volunteers. The HLB play a part. There's a volunteer group. There's a Hodge litter pick group. There's the Bromford litter group. There's also the Hodge residents litter group, and they're always reporting. Matt, so we can get items picked up quite quickly. Last week, I got notification at 5 in the morning, or 4:45 in the morning, of a load of fly tip in Hodge Common on the actual highway. So it's difficult for cars to go up and down on the highway. and we managed to get that removed within like 15 minutes. When I rang the emergency line that councils have access to, and they moved that because obviously it was a danger to persons and property. But as Councillor Clark said, I've been multitasking tonight. I've been going into a Labour group meeting as well, where we've had a briefing, and there'll be news coming out tomorrow 8:30 around how we're going to use the investment that we set aside to tackle fly tipping and basically around the street cleansing agenda. And it's really good stuff. And I know there's lots of people in this meeting today who have done a tremendous amount of work volunteering to keep our streets clean. And we are going to give you the biggest support that you can ever imagine. I know in the last few weeks, we've been giving out lots of kits to community groups, and a number of residents who are in this forum have been the beneficiaries of that. This is going to take that up a notch. And we've got to remember, we can't reward people who are fly tipping, and it is an offence. People need to remember that it's an offence. And I know it's difficult, and I'm not even going to ask people to give statements on their neighbours who might be doing it, because obviously you're living with these people and you need to keep the peace. But we do need to stop it happening in its tracks. So we're going to bring more support out, which I can't release information till tomorrow morning. But you'll all be really, really happy with what we've got planned. And if that works well, and the continuation of working with volunteers and with residents, and especially there's lots of people, like we see all the people on social media who carry out litter picks and they promote it, which is a really, really good thing. But honestly, my heart goes out to the number of people that I know, the below the radar people and groups who carry out a tremendous amount of work within Bromford and Hodge and in Ward End, and don't even say anything. On my run and Primley, I've got one person, one of my neighbours, once a week at least, if not more, he will go out and he will pick up the litter that's left on the streets. And he doesn't go on social media, he doesn't promote it, but he does that because it's part and parcel. I used to remember my late father on Boyer Road in Alum Rock. Every Sunday, this was before car washes were around. If any of you as old as I am, every Sunday I used to see on the road at least a third, sometimes half of the street used to be out washing cars. It's a bit like a community event, washing cars, sweeping, the frontage of their property, sweeping the frontage of their neighbours who couldn't do that. And it was brilliant. And that's the kind of community spirit we need to bring back. And with the Commonwealth funding that's available to groups, and remember, you don't need to be an organisation to apply for that funding. Anyone can apply for that funding, and I think everyone should, and that would hopefully bring the community spirit back to us, because we have got lots of different communities from in and around the Commonwealth. Their origins are from the Commonwealth. I think it'd be great if we could all work together in bringing about a safer, cleaner Bromford and Hodge and Ward End as it's a joint board forum. And the other thing I just wanted to pick up on was around the parks. We've all got lots of parks in our wards, Ward End Park, and we've got a number of parks in Bromford and Hodge, and we're trying to create more space in our parks. We're still working on getting a football pitch and some play equipment, gym equipment in Stretford Hall Park, and hopefully before the summer holidays we will have a revamped park on Bromford Drive, the larger park, and there's also some work being done. And thanks to everyone who participated in the consultation for the pocket park on the old Warstone Tower site. That's all going through. The officers are basically going through all the feedback that they've had, and they'll come back to us and we'll bring them to a ward forum as well, and we'll have that. And there's also some consultation, Diane's leading on this, around the Firs in trying to bring about another pocket park around there, because that's part of the ward which hasn't benefited from having some play equipment for our children. The flood defences, we're going to speak to Environment Agency this week, and obviously because of COVID, it's been delayed. If it was up to me, and if it was up to the contractors at the Environment Agency, that work would have been completed. But I drove past there today when I went to work, and the wall's looking quite nice. As you come onto Bromford Drive, it's looking pretty cool. And further down you see the walking path as well. So I know, I apologise to residents of primarily Bromford, within our ward of Bromford and Hodge, you've got lots of disruption. My heart goes out to you. You've got lots of disruption. You've got HS2 working there. You've got the Environment Agency working there. You've got highways there, and you've got this bleeding fatberg that Severn Trent are also trying to dismantle. And if you saw the picture of me that day, that particular piece of fatberg, by the way, that was one of the pieces that wouldn't go up the drill. It was so big and it was so hard. It was solid. Because most fatbergs are made up of nappies and wet wipes and other items I don't really want to mention in cases and children listening in, and they tend to dissolve. But because of the fact that we've had so much ploughed into the sewage system, it's getting worse. But believe me, within I would say give it 18 months, 2 years, not for the fatberg, that'll be a lot quicker than that. But the development around the Bromford, I think you guys, we've got something really, really good to look forward to. And in 2 years' time, people from across the country will be coming around that part of our ward in the Bromford to see how we've done the development. More than 250 new properties. We're tackling all the issues around the green spaces, and there's still some work that we need to do, myself and the chair, working with the HRB in terms of what we do with a lot of the green spaces and the garages. But you'll see, the vision we've got alongside us, and we're blessed that we've had so much money ploughed in. For years, myself and the chair were getting criticised. Oh, nothing happens on the Bromford. We're not getting any investment. You've had more investment than most of the city outside of the city centre. I honestly think that we've had the most investment now in terms of the city. I've noticed I've gone on for quite a while, Chair, and you give me that funny look that you give me, like, shut up, Majid. So I'm going to shut up now. Thank you.
Thank you, Majid. That fatberg was shocking. It actually looked like a piece of granite, like rock, and it's incredible. But
it was hard as a rock, honestly. When they showed it to me, I thought it was a piece of rock. But then, they took it out of the drill. They were showing me what it was, because the drilling system is so the pipe on Chipperfield Road that gives out the water to redirect the sewer alongside the other part of the water, so that they're not basically putting stuff into where the fatberg is. So the fatberg is sandwiched between Chipperfield Road and the actual sewer behind Fort Dunlop. And if you are going to have your dinner now, probably best not to listen to this.
Okay.
And the fatberg is from that part all the way underneath. And the problem you've got underneath the motorway, the M6, where that is, instead of a straight pipe because of the motorway, it goes down to like a loop. So if you look at the bottom of your toilet where you've got that loopy pipe, that's sort of like
U-bend.
The U-bend. And you can imagine that on a bigger scale, you've got a U-bend under the M6, and that's where the fatberg is being created. So they're trying to push it, and it's hard. Normally, with the water, it would just go through. There would be a good system, but over time, and the fact that people have, this is a piece of work that I think the council need to do in terms of educating. And again, Radio Abkhaz would be really good if we could have a session with them around, advising people. I'm waiting for some info from Severn Trent, because one of the things that Severn Trent have said is they're going to reprioritise their educational training for children. So Bromford and Hodge is going to be prioritised now. So we're going to have more of the Severn Trent sort of like people who educate people around what not to throw down your sink and toilet. They're going to come round. So that's one of the agreements we've got with them. But it's a difficult task for them, and it's a new task for them. So they've created that new temporary site. It's costing them an arm and a leg to do. But once it's been done, then you'll have the best sewage system in the city. And again, I just reiterate, you give us time, you will see a major difference in terms of the Bromford, in the overall Bromford. Like, we had opposition to Tesco many years ago, and look at the state we now. People can't live without Tesco in Hodge. Thanks, Chair. Thank you, Majid.
Yeah, I'd just like to say thanks as well to the volunteers. We've got a few, and they're mainly elderly. I've got a lady in her 80s who litter picks just her stretch of the road and does the grass verges. So we've got a few of these individuals dotted around the ward, and they don't want any publicity. They're not in it for any gain, but they just want to keep their stretch of the road clean. It's something I do myself for my stretch of the road, and most of my neighbours are elderly, so there's just two of us, well, I won't say young, but we're younger, and we do that for all the neighbours. So, and there's a lot of these unsung heroes around the world, so I really would like to show my appreciation to them. Thank you. I'll pass over to Councillor Cllr, who wanted to say something.
Thanks, Diane. Just exactly what you've just said. I've got three volunteers, litter pickers. One of the guys, Paul, he's known as, I mean, he texts me every single day, and he litter picks from 3 till 4:30 in the morning, 4 times a week. And he's absolutely fantastic. He'll report any fly tippings down to me. He sends me photographs. One guy, he lives on Common Lane. He does it twice in Ward End Park. Now, these are the people who don't advertise, or, you know, they'll just do it because they love litter picking. And the other one, I think you know him, and he wouldn't mind me mentioning his name, is Rob Harper. He's going to start doing Ward End Park twice a week. Absolutely fantastic people. They don't use that media platform to tell us why they're doing it, but they're in contact with me virtually every single week, what they've done, and, you know, absolutely unsung heroes, I say. Just on the, Majid's reminded me, just on the highways budget, I've got a spot on Southern Road and Washwood Heath Road, right on the corner, where there's a lot of empty space, a green space, if you like. There's grass and everything, and people tend to park there, and it's a blind spot. We've had quite a few accidents, so I've asked the highways steward to actually have a look at that, see what we can do with the highways budget. We've got either bollards or just stop people from parking there, because it is very, very dangerous, and health and safety is involved. So they're currently just having a look at that and see what they can do to stop people from parking there. Thanks, Diane.
Thanks, Councillor Cllr. Right, I think that we've got, just looking at the agenda, the next item is local community groups. If we've got any updates from local community groups, I'm not sure we have any here this evening. So
it's Natalie here from NNS still.
Natalie's just left. She's had to go. So
oh dear.
Yeah. So
they've got some funding for over 50s. They're looking for people around, you know, Bromford and Argyll, Allen Rock, Ward End. So if there's any community groups over 50s, they're actually looking at. They've got loads of funds, which so I didn't know she'd gone, because I was going to give her, you know, 5 minutes just to brief everybody. Maybe next time, because she's quite regular.
I'll get the information from Natalie, and we can distribute it to known groups in our wards.
Okay. There is an NNS meeting this week, so I'll get her to email yourself.
Okay, yeah, and then I'll pass the information on. Right. Anybody else wish to ask a question? No. Right, well, thank you for attending, everybody. It's been an interesting meeting on the coronavirus update and what's happening in the wards. Also, we've got the Commonwealth Games community funding, which we'll be having when we know who's actually applied for the bids. We'll have another meeting on that in the near future, and see how we can progress the applications. So that will be an interesting meeting. So right, well, thank you everyone for attending, and we'll update you on the next meetings. We should have something on the regeneration. We're getting updates on regeneration, so that will be on the agenda, and obviously the Commonwealth Games. So thank you, Councillor Cllr, Councillor Mahmood, and Bev and Pat for attending, and and for all the presenters, but well, the presenters have gone now, but and the attendees. So we'll see you at the next one.
Thanks, Chair. Thank you very much.
Yeah, thank you, Chair.
Everyone can go and
Thank
enjoy
you,
the
everyone.
football now.